Hi everybody, Dr. Britt Talley Daniel MD, headache doctor, neurologist. I'm doing a YouTube video today on migraine and depression. So migraine headache is 12% of the American population, and 20% of women and 6% of men have migraine. 10% of patients in America develop depression. Migraine headache is the fifth most common cause of disability, the 10th most common cause of visit to the emergency room in America. And the three most painful conditions they teach in medical school are kidney stone, childbirth, and migraine headache. And migraine is a complicated neurologic process involving the ganglia of the trigeminal nerve, the cerebral arteries, and the thalamus. In the process of this event going on in the brain, three inflammatory and vasodilating neurochemicals are released, and these are neurokinin A, substance P, and CGRP, which is an abbreviation for calcitonin gene-related peptide. Serotonin neurotransmitters located in the trigeminal nerve and the cranial arteries are reduced during migraine, and low serotonin levels are also linked to depression. So migraine and depression are comorbid medical problems, and comorbid means that these two medical problems come together or occur together more commonly than by chance. And migraine and depression are 50% comorbid, which means that half of persons with depression have migraine also. The exact reason for this relationship is currently unknown. The instance of connection with depression is higher in persons with migraine with aura and with medication overuse headache. So let me define migraine. It's a recurrent headache disorder manifesting in attacks lasting 4 to 72 hours, and typically the headaches are one-sided, throbbing, moderate in severe intensity, and aggravated by routine physical activity associated with nausea and vomiting and or sensitivity to light and sound. Depression, according to the Diagnostic Statistical Manual of Mental Disorders, version 5, a person that suffers major depressive disorder must either have a depressed mood or a loss of interest or pleasure in any daily activities for at least 2 weeks. And the symptoms here are a depressed mood most of the day, nearly every day, as indicated by either the patient's own subjective report, they feel sad or empty, or observation made by others, that is, they appear tearful. In children and adolescents, this depression may be characterized by irritability, markedly decreased interest or pleasure in all or almost all activities most of the day, nearly every day occurs. There's significant weight loss when not dieting, or weight gain, or decrease or increase in appetite, nearly every day. Insomnia or hypersomnia means you sleep too much, nearly every day. Psychomotor agitation or retardation, nearly every day. Fatigue or loss of energy, nearly every day. Feelings of worthlessness, excessive inappropriate guilt, nearly every day. Diminished ability to think or concentrate or indecisiveness, nearly every day. And then recurrent thoughts of death, not just the fear of dying, but recurrent suicidal ideation without a specific plan, or a suicide attempt, or a specific plan for committing suicide. All right, I have some related comments regarding the two subjects. What's the age of onset? Well, migraine usually starts in mid to late adolescence. It peaks in the 30s and then kind of diminishes after that. Middle-aged women aged 40 to 59 years old have the highest rates of depression. The lowest rates of depression are among teenage boys ages 12 to 17 and in men over the age of 60. Sexual preference. Women have migraine 3 times more than men and depression 2 times more than men. Genetic link. Major depression increases the risk for migraine, and migraine increases the risk for major depression. So this is a bi-directional association, with each disorder increasing the risk for first onset of the other. That's not found for other kinds of headaches, like tension-type headaches. Migraine is thought to be genetically linked, but polygenic in origin. It means there are multiple complex gene relations are found with migraine, except for familial hemiplegic migraine. If you want to get on my website at drmigraine.com and go to this subject, you can read about that some more. Depression has 50% of cases where the cause is genetic or related to heritability, and the other 50% of depression cases are unrelated to genes but due to conditions that seem to predispose to predisposed to depression. What are those? Loss of parent in early life, severe childhood physical or sexual abuse, childhood emotional and physical neglect, severe life stress. Epidemiology. Migraine affects approximately 12% of Americans every year, and migraine is 3 times more common among women than men. It's like 20% versus 6%. Migraine attacks peak in prevalence between the ages of 25 and 55, and migraine is a chronic disease which occurs episodically. Other psychiatric relationships. Major depressive disorder occurs 2 to 4 times more in migraine patients. Lifetime rates of depression range from 22 to 32% among those with episodic migraine, or as high as 57% among those with chronic migraine. And most of those folks have medication, overuse headache, and are over-treating painkillers. Migraineurs have a 3 to 4-fold increased risk for bipolar disorder and for suicide attempts. Among migraine sufferers, anxiety disorders are twice as common as depression, and migraineurs have a 3 to 5-fold increase in risk for the various anxiety disorders. Panic disorder, phobias, PTSD, generalized anxiety disorder are most common among migraineurs. There's no current evidence that improved controlled depression helps to control migraines. However, it's important to identify and treat depression in patient migraine because it's a significant predictor of migraine chronification. Furthermore, migraineurs who suffer from depression are more likely to be refractory to migraine treatments and to suffer from medication overuse, headache, and disability. Depression is by far the most prevalent of all main mind-brain illnesses, representing 99% of all mind-brain illnesses, whereas schizophrenia and major psychotic illness represent the remaining 1%. The umbrella of depression encompasses major depressive disorder and its related mood disorders, including bipolar disorder, postpartum depression, post-traumatic stress syndrome, anxiety disorder, and suicide. Depression in the United States affects over 18 million adults. That's 1 in 10 in any given year. Depression is the leading cause of disability for ages 15 to 44 years old. Depression is the primary reason why someone dies of suicide, which is about every 12 minutes, or over 41,000 people a year. Homicide claims less than 16,000 lives each year, according to CDC data from 2013. Depression in the workplace causes 490 million disability days from work each year in the United States and accounts for $23 billion in lost work days each year. Takes an economic toll over $100 billion each year from U.S. businesses. Depression internationally affects over 300 million people worldwide, regardless of culture, age, gender, religion, race, or economic status. Depression is one of the most debilitating conditions in the world, with severe depression rated in the same disability category as terminal stage cancer. Just think of that. Wow. Depression is the leading cause of disability worldwide as a major contributor to the overall global burden of disease. Now, at the end of this talk, I want to give a comment that's personal on the use of SSRIs or SNRIs. These are drugs like Prozac, Paxil, Lexapro, stuff like that to treat anxiety or depression. These drugs work well for depression, anxiety, PTSD, and panic disorder, but they do not work for migraine prevention, although there's a lot of confusing data about that. So, this is the end of my talk today on the subject of migraine and depression. God bless all you persons who have migraine and are depressed. Please subscribe down there so we can keep in touch with each other. And God bless you all. I'll see you again on the next talk.